So our next event is Future Speak. We have diversified panelists across health management, private healthcare, and health tech. This event will be moderated by Dr. Ajit Singh, 1985 IITBHU alumnus, Managing Director of Artiman Ventures, Adjunct Professor in School of Medicine, Stanford University, and Board Member in Max Healthcare. Over to you, sir.
Thank you, Kirti. Since we're running way behind schedule, I'm going to try and keep the introductions to very, very minimal. When it comes to Indu Bhushan, Sangeeta Reddy, and Rahul Sharma, if I'm to say they require no introduction, then I should stick to that rule. They require no introduction. They have tremendous, a wide range of experiences and accomplishments. And I think what makes them truly unique for this audience is their sheer breadth of experience, their sheer breadth of exposure, the transdisciplinarity that goes into crafting the kind of topics that we are talking about. That transdisciplinarity is going to be very, very critical, and that's what makes the session very exceptional. So Dr. Indu Bhushan, Dr. Sangeeta Reddy, Rahul Sharma, welcome to you all. As you know already, the format is we're going to go approximately 7 minutes each presentation, followed by a free-formed conversation that I'll be moderating. So without further ado, Dr. Indu Bhushan, I'd like to invite you to open our session.
Thank you very much, Ajit, and thank you very much for inviting me to this session, back to be among friends and co-IITBHUites. In my 7 minutes, I'll just going to be sharing with you the current status of health sector in India and what the government is doing to improve the situation. Many of these things were planned before COVID, and with COVID, of course, has given an impetus, further impetus, and we are going to be seeing some new things coming on board. And I'll just try to whet your appetite, and maybe during the question and answers, I can come back and provide you some more details. I'm just sharing my screen here. See if it works. Can you see my screen?
Yes.
Can someone? Okay, all right.
Yes, very much visible.
All right. So starting with the status of health sector in India, and of course, there are many things that we can be proud of, and you can say glass is half full. And but of course, there is a way to go, and I'll focus on areas where probably we need to do more and some challenges that we have. If you look at this slide, which shows improvement in life expectancy at birth between 1990 and 2016, which is fairly recent. And the thick orange line is India. And you can see that in 1990, we were about 59, 58, 59 years life expectancy. Now we are more than 65. So in 25 years time, there has been a significant increase in life expectancy. But other thing that you'll see is that there are many other countries who have done much better than India. And one particular country I like to pick up is Bangladesh. And Bangladesh is the blue line, the blue thin line just above India. And in 1990, Bangladesh and India were at the same level. Now the difference has slightly, you see, we are diverged. Bangladesh, much poorer country in terms of per capita income, has done much better. So obviously, while we've done well, we could have done much better, and we should be looking to do better. Another slide I want to share is about out-of-pocket expenditure and how much we spend. The previous speaker had shown that our health expenditure actually has been increasing. But if you look at the percentage of GDP that we spend, that has not been increasing. That has been consistently around 1.2 to 1.3% of GDP. And that is what we are representing here on x-axis. So this graph represents actually 2 or 3 things. One, that countries who are spending more, their out-of-pocket expenditure is much lower. Out-of-pocket expenditure is the expenditure, proportion of expenditure that families have to spend out of their pocket for on health. So if you look at, say, Thailand, for example, only about less than 20% of the expenditure is out-of-pocket expenditure. In India, it's more than 60%, about two-thirds. Of course, it has a lot of implications, both of efficiency and equity. It's much more punishing for poor people who don't have resources to spend. And also, when you have to spend out of pocket, you tend to delay treatment, and that also has implications for efficiency of expenditure. And if you look at India, there aren't many countries which are below India. So India is one of the countries, one of the maybe out of 200 countries, India's number will be about 10th from bottom in terms of public expenditure. And that is showing in also high out of pocket expenditure. And in India, large number of people, and some studies say close to about 6 million people fall into poverty, 60 million people fall into poverty every year because of expenditure on health. So that's another issue with the Indian health sector. Other thing that we are seeing all over the world, but also in India, is that there is a what we call epidemiological transition. Our burden of disease is changing, which was earlier dominated largely by communicable diseases to non-communicable diseases. So if you compare the disease pattern in 1990 to 2016, you'll find that in 1990, top 5 diseases were communicable diseases like diarrhea, respiratory infection, and others. Now, if you look at the pattern of diseases, these are non-communicable diseases, and they are much more difficult to treat. In many cases, you have to provide lifelong treatment for those, and they need to be treated through more lifestyle changes in many cases, which is actually much more difficult, much more expensive, and much more long-term. So it has implications for cost in the long run. And now it's not only that only the rich part of the population, but also the poor part of the population is experiencing this, not only in urban areas. We are seeing that in rural areas also, there is a dominance of non-communicable diseases. Third thing is about the quality of infrastructure and quality of services being provided. And this was a very recent study which has shown that there are about 2.4 million Indians who die because of treatable conditions every year. And this is the actually in terms of comparison with other countries, we are not doing very well. But one thing came out of the study was that there was a 1.6 million Indians who died not because of the lack of services, but because of poor quality of services. And if you see this graph, which compares India with the neighboring countries, you'll find that large number of people, the green part, have died because of the poor quality of services. About 800,000 people have died because of non-utilization of services. So in many cases, actually not having services could be much better than providing bad quality services, because I think that hastens in some cases worsens the health conditions. Now, so just to summarize, we have a high increasing burden of disease from non-communicable diseases. We are aging fast. That is also has implications for the kind of diseases we have. In terms of health expenditure, we have low government spending. We have inequitable distribution of health services. We are much better off in urban areas, in southern states and metropolis. We look at the doctors, availability of services in tier 2, tier 3 cities, rural areas, we are much worse off. Affordability, there's a high out-of-pocket expenditure, which has implications for equity in the country. Also, evolving and new technologies are increasing the cost. And lastly, there is a challenge of regulating the private sector and regulating and improving quality in public sector. So quality, while we can boast or we can be proud of a lot of very high quality hospitals in the country, but at the same time, when you look at, there's a huge variance, and you will find hospitals all over the country which are marked by low quality of provision. Now, what are we doing to improve all this? There are large number of things which are in place. Couple of things that we are looking after directly. One is Ayushman Bharat, And Ayushman Bharat has two legs. One is the establishment of 150,000 health and wellness centers, which will strengthen primary and promotive healthcare. And the second is the Pradhan Mantri Jan Arogya Yojana, which is supporting more than 500 million people for secondary and tertiary care, and providing them up to 5 lakhs, 500,000 rupees for any disease or any health condition that requires hospitalization. There is a huge emphasis on improving medical education. Earlier structure of MCI has been now transformed into National Medical Commission. A lot of flexibility, a lot of innovations have been introduced to give a huge push to medical education. Recently, Honorable Prime Minister launched National Digital Health Mission. I'll come to that quickly and share with you that what it means and what it implies for the health sector. There is definitely a push towards increasing government spending, and we are committed to increasing health sector spending to 2.5% of GDP from current 1.2%. Again, there is a focus on increasing our support for disease surveillance and control, and this is coming directly from COVID. And there's a very strong, very investment going into improving surveillance system. And finally, lot of emphasis on public-private partnerships, including the presentation that we saw on vaccines, but not only vaccines, but provision of services, hemodialysis, and many other areas where we are seeking partnership with the private sector, recognizing that we can learn a lot from you. Just a couple of minutes on National Digital Health Mission and what it is. Actually, I can come back to it later, but this is to establish state-of-the-art digital health system and managing health system through digital health. We intend to improve the quality of health data collection, storage, and sharing, and improve we want to establish a platform for interoperable system for health care data. We are in the process of establishing several health registries, registries of doctors, other healthcare staff, healthcare providers, healthcare facilities, not only hospitals, but labs, diagnostic centers. And we are going to be creating registries of implants and drugs and many other areas that those registries will help in terms of improving data and also connecting the health sector and providing a more integrated management opportunities. And through this, we hope to improve the provision of quality services. We hope to improve monitoring of our schemes and have more evidence-based policy making. And finally, just to snapshot that right now we have put in place and rolled out this mission in 6 UTs, where we have started creating unique health IDs. We have started creating doctors registry that we call DigiDoctor. We have started health facility registry, where we are registering all different kind of health facilities. And we've started creating personal health records, which are linked to health ID and are linked to a consent manager, where individuals can share their personal health record with any provider based on consent, based on informed consent. We have started also working on telemedicine, and have been working with the private sector Swasth group for telemedicine. And we are also inviting expression of interest from other groups if they want to work with us on telemedicine. E-pharmacy, we are still waiting for regulations to be cleared, and then based on that, we'll start work on that. In the closing, I want to just say that the health sector is really poised to take off right now. And you would see that maybe I was always saying earlier that, health sector, when you look at health sector later sometime, you would always say health sector before and after Ayushman Bharat. Probably now it will be health sector in India before and after COVID pandemic, and you'll find that after COVID pandemic, health sector is remarkably different and much better, I hope. Thank you very much again.
Thank you, Indu. And for those of us from IITBHU and specifically those from EE would remember Professor A.N. Tripathi, who in his systems engineering course always used to say that if EE will teach you one thing, it's the systems thinking, it's the ability to structure a problem correctly. And Indu, in your comments, which were very, very concise and yet covered a full 360-degree view, that the ability to structure a problem, the systems approach was very, very visible. So thank you.